Hi, I'm Cameron Allen with Adler Dermatology and Joules Medical Aesthetics. Today we have the awesome opportunity to speak with Dr. Lauren Michelsen, who is an OBGYN and a health advocate for women's health. She's going to let us know what's remarkably new today and really about the Mona Lisa platform. Dr. Michelsen, hello.
Well, hello, Cameron. How are you?
Your hair looks like spot on gorgeous, can I tell you?
Oh, well, thank you. Compliments of John David. Anyway.
Love it.
Yeah. So anyway, I know we're here today to talk about the Mona Lisa Touch Laser, and I'm really excited to tell you about it.
Well, I only know about the Mona Lisa because of her famous smile. So tell me about this. What I've heard a little bit about it, but not a whole lot. Why do women need to use the Mona Lisa?
Well, it's not for everybody. I'll put that right out there, but it's for a huge majority of women who usually won't talk to their doctor about why they might need it. The Mona Lisa Touch is a revolutionary CO2 fractional laser that treats women who have genitourinary symptoms of menopause, such as atrophy, vaginal dryness, irritation, dyspareunia, which is pain with intercourse. So it treats a lot of symptoms that a lot of women are usually not willing to talk to their doctors about.
That's true. You know, we girls can talk about everything, about butt implants, boobs, fat, Spanx, but I feel like we don't talk about the other muscle that's really important. So I'd like to understand before I am looking up at Brooke Burks and her fabulous adult diapers, which I never want to do. Tell me about why this could save me from that pathway.
Well, so traditionally a lot of women as they get older will take estrogens and different hormones to try to keep everything youthful like it used to be. But it's really not 100% accurate. And for a lot of women, they can't take it or they're afraid of hormones. But this will actually treat the inside walls of the vagina and regenerate and help to restore the vagina to what it used to be. And it is important to talk about it because if you have a partner and you want to be intimate, you need to take care of that part of you. And even if you don't have a partner, you don't want to suffer from the dryness and the irritation and just the lack of elasticity to that area of your body.
Is it going to hurt? What's the recovery time? You know I'm an addict with working out.
Oh, yeah.
What's the downtime on something like this?
None. Absolutely
Wow.
none. That is what is so beautiful about it. Because there's two different ways we can treat. We can treat the inside of the vagina, and that literally is no downtime. It is a 5-minute treatment. It does not hurt. You can go to the gym immediately after, take a spin class, yoga, whatever you like to do, you can do after. You're just supposed to refrain from having intimacy for 24 hours after that. Then if you want to treat the outside part, the vulvar part, which is more, I wouldn't say cosmetic, but it can also treat lichen sclerosis and other conditions. That has a slightly more of a downtime, but you could still go to work the next day. You just don't want to do rigorous activity for like 3 to 4 days.
I see. How will I know it's working? I mean, after 24 hours, if I'm intimate with my significant other, will they say, honey, did you do something? Will I know or will he know?
You will definitely know the difference.
Oh.
You will immediately have
and I'm
more
important, guys. So
you are. Yeah. No, you will immediately notice a difference. You will have more like nourishment to the vagina. So you're not going to have the dryness that you used to have. And most women literally will feel a difference within the first 24 hours. And then after you do all 3 treatments, I would say 90% of the women notice a remarkable difference. And their partners sometimes notice the difference in the elasticity and the thickness of the vagina. So it's really good for everybody.
Awesome. So is this something affordable? And can I bill my insurance? I mean, at the end of the day, what's the beef on this? Is it affordable?
Well, unfortunately, insurance doesn't cover it. But if you think about how much money people pay for lubricants, for estrogens, for creams, for pills, which you have to take the rest of your life, this is 3 treatments that you do in 1 year with 1 spot treatment a year later. This ends up being a lot less money than all of that. So, and it depends on your provider and how much they're going to charge. It's not completely inexpensive, but over time, I think it's definitely well worth the money.
Thank you for joining us today with Dr. Lauren Michelsen, learning more about the Mona Lisa and why she smiled. The code today for calling us at the Plano location of Adler Dermatology and Joules Medical Aesthetics is Lauren. That's Lauren. Look at the number and code below. Thank y'all. Look forward to our next time.